guys, welcome up to the Kelvin TV. On this episode, I want us to talk about the things you need to do for a patient before he or she will be taken to the theater, or the pre-operative nursing care that you're going to do for a patient who has been scheduled for a surgery. Guys, I know most of us have witnessed surgery, or we have witnessed patient being taken to the theater, but we don't know the process that they go through, the step-by-step process they go through before the patient will be taken to the theater. That's the reason why this video is very important to you, and I will urge you to subscribe, like, comment, and please share for me so that we can reach wider audience. The first one that we are going to talk about is known as verification and identification of the real patient. So the first thing that you need to do is you need to identify the real patient that the doctor has scheduled for the surgery. So you need to know the real patient by getting to know the patient number, the real name, the age, and the type of surgery that the patient has been scheduled to undergo. So that's it. Then the next thing that you need to also do is you need to confirm that the consent form is signed. Confirm that the consent form is signed. So before a patient will be scheduled to go for a surgery, then that consent form here already signed. They have signed the consent form that truly the patient has agreed to undergo that surgery. So you need to check and see that the consent form is signed. So then the next thing is you need to check the vital signs. So checking of the vital signs will let you get to know whether the patient, there is some abnormalities or there is something wrong with the patient. You will get to know. So you need to check the vital signs and make sure the vital signs are in the right ranges. You need to make sure they are in the right ranges so that should in case there is any abnormality, you'll be able to report faster. Then the next thing that you need to also do is you need to ensure that the surgical site or the place for the surgery is being secured and cleaned. One thing that I've seen is mostly we don't do it here. The place that they are going to do the surgery, you need to make sure that place is very clean. What cleaning with surveillance and other things, chemicals, so that